Hi everyone. Today we're going to be talking about labor positions. Which is the most comfortable labor position? Is there one? Well, the most comfortable labor position is the one that you feel most comfortable in. So let's take a look at some of those labor positions, the benefits, and why you might want to try to use all of them or some once you start going into labor. Let's start with walking. Let's see. Walking is something you'll be more likely to do early rather than later, since it'll be harder to head for the corridors for a few laps once the constructions are coming one right after the other. So, walking is something that you might want to try at the beginning because after, once the contractions get stronger, then it's more difficult to walk. So let's take a look at standing. There's a great reason to get vertical. It can help you work with gravity, allowing your pelvis to open and your baby to move down into your birth canal. So, standing is something you can try, leaning over a wall or leaning over your partner's shoulder for support during contractions, because it's hard to stand up straight when you're having contractions. So now let's take a look at rocking. Rocking either on a chair or swaying back and forth allows your pelvis to move and encourage the baby to descend. And let me tell you, the more upright that you are, the more gravity is able to help you out. So that's something to keep in mind once you, like I said, once you start going into labor. Please don't forget that detail. Okay, so let's take a look at sitting. Let's see. Sitting in bed, on a chair, or on a birthing ball can ease the pain of contractions and allow gravity to assist in bringing your baby down into the birth canal. So, sitting also helps to open up your pelvis and is easier than squatting for long periods. So, something to remember as well. So now let's take a look at leaning over or kneeling. Let's see the benefits. Leaning forward over a stack of pillows on a bed or kneeling over a chair or birthing ball can be super helpful when you have back labor, when the back of the baby's head is pushing against your spine, because it encourages the baby to move forward, taking the pressure off your back. So again, in this position, you can use your husband's shoulder to lean over, so to help you with the contractions. It'll be easier to deal with the contractions. So now let's take a look at side lying and their benefits and why you might want to try using these labor positions. Let's see. Side lying allows you to relax your body without increasing pressure on major blood vessels, which can compromise blood flow to your baby. So, something else to remember, you don't want to compromise the blood flow to your baby. So, side lying is an excellent position. So let's take a look at squatting and their benefits. Squatting is beneficial because it tilts the uterus and pelvis forward, placing the baby in proper alignment for delivery. This is a very interesting position, squatting. And you can use also your husband for support. And try to exercise so that your muscles are strong enough to support you in case you want to use this interesting position. So let's take a look at hands and knees now. These positions allows you to do pelvic tilts for comfort while giving your partner great access to your back for massage and counter pressure. It also opens the pelvis and uses gravity to help the baby down. So going in all fours is another way to relieve back labor. Keep that in mind. And many mothers, they like this position for delivery, no matter what kind of laboring scenario they're having, they really like this position for delivery. So let's take a look at semisitting. This position does not have all the benefits of upright positioning and shouldn't be used for long periods of time. However, it's better than lying flat on your back. So again, something very important to remember, try not to use this position for long periods. In hospital settings, most of the time they ask you to be semisitting, but please ask them that if you're able to move around, because you want to be able to walk, you want to be able to be sitting, to rock if you can. So you need to talk to your healthcare provider. Now let's talk about a position that a laboring woman should not adopt. Let's see. The one position a laboring woman should not adopt is lying flat on her back, because the weight of the baby puts pressure on a major artery, restricting blood flow to the baby. Prevent this by putting a small pillow or weights under one side of your bed, so you're lying slightly to the side. So please avoid that position. It's not the most, I'm not gonna say it's not the most comfortable, but it's not the most favorable one. It's not the one that is gonna help you cope with the intensity of labor better, and it's gonna cause your baby to stress out, and you don't want that. So I hope that you like this video. If you like it, please don't forget to press the like button. If you would like to start following me, please do not forget to subscribe and to activate the bell notification button as well, so that you know every time that I upload a video. wondering where I am, this is a very, very special place. It is called Moros and Spaniards, and is located in Salcuatitan in El Salvador. So if you ever want to travel, this is a great place to visit. So I hope you like the video, the information. I hope the information can come in handy, and I hope you have enjoyed the view. Please take good care of yourself, because by doing that, you're also taking care of your baby. Until next time, bye now.